Nobody thinks it's a good idea to go without health insurance. But health insurance is so confusing and expensive. It's almost like the big insurance companies like it that way. But you might like to know that insurance isn't the only way to secure great health benefits. My name is Grace with Healthcare Benefits Network, and I'm going to tell you how anyone can afford really great health benefits that don't suck. What makes health insurance in America so bad? I talk with people about health and health benefits every day. One of the first problems people tell me is how confusing it is. It's hard to figure out which plan you should choose, what's covered, what isn't, which doctors can I see, will the HMO cover my needs, or do I need to pay more for the PPO? What counts towards my deductible, and why is my out-of-pocket so high? Who can afford that? For most people, it's so high that it's almost like not having coverage at all. Why does the insurance company get to penalize me because the doctor I want to see is out of network? The next thing people talk about is how expensive health insurance is. Health insurance premiums for a family can easily cost more than the monthly food budget. Take a quick look at how insurance premiums have increased, rising faster than wages in most years. Then there's a giant deductible that works like a barrier between you and the healthcare you need. Your deductible can be $6,000 or more. Meanwhile, your out-of-pocket exposure to medical bills could be 2, even 3 times your deductible. What kind of a health benefit is that? What most people fail to realize is that health insurance companies are in the business of collecting money and paying medical bills for a profit. They talk about trying to keep costs down, but if they were any good at it, why would premiums continue to go up so much every year? If big insurance companies like Blue Cross were getting the very lowest rates for healthcare, wouldn't the premiums be going down? So why don't they? Well, the secret is that these big companies are not charities. They make a profit margin every time they spend another dollar on healthcare. The premiums they charge are derived from the cost of the medical bills they pay. In other words, as costs for healthcare increase, so do premiums and profits. Everyone I talk to understands how bad the health insurance racket is. But the key to locking up affordable health benefits comes down to understanding a few basic facts about people and their health. It's a commonly known fact that most people identify themselves as generally healthy. Most people just don't go to the doctor that often. This is easily overlooked if your only options are built around health insurance that's only intended to benefit sick people. This simple fact is the foundation for securing affordable health benefits intended to work for real people. Now, even though most people are healthy, everyone still has routine needs from time to time. So for health benefits to be great, they have to include low-cost, super easy access to routine, preventative, and primary care. The foundation for better health benefits is access to low-cost everyday care from a dedicated primary care team. After that, you just have to have a reliable way to pay for the big unexpected medical bills. Fortunately, there's a whole new approach to great health benefits that addresses both of these important aspects of your healthcare needs. The first part is called direct primary care. It's also known as membership-based primary care. It works like this. Instead of paying your doctor per visit or per service like we're used to, these DPC doctors only charge a simple monthly membership fee. Members get unlimited access to their primary care team, in person or virtually. Members pay nothing out of pocket for all their routine health and wellness needs. Then, to prepare for large unexpected medical needs, a more affordable medical cost-sharing membership will pay for any significant medical expenses after you pay an initial unshared amount, similar to an insurance deductible, but usually much less. Now let's take a look at how these two things will save most people a lot of money. One way membership-based primary care saves money is known as virtual medicine. This is one of the biggest silver linings to emerge from the pandemic. During the lockdown, virtual healthcare became widely appreciated as a new best practice. Digital health was previously only used for routine episodic illness, and quick check-ins for prescription refills. This newer version of digital medicine involves a dedicated care team for each patient. For this reason, it's ideally suited to address a more comprehensive range of routine, chronic, and preventative care. When DPC members need higher-level healthcare, the DPC doctors will help the patient navigate the system and get the care they need. It's quick, easy, and costs you nothing more than the low-cost monthly membership. This eliminates long scheduling delays just for a 3-minute visit with your doctor, Drive time, traffic jams, crowded parking lots, and sickly waiting rooms are all a thing of the past. With medical cost sharing, you have an affordable and reliable way of paying for your catastrophic costs. When big health insurance has been dominating the market as a profit-driven business, nonprofit medical cost sharing was quietly growing its membership too. It's performing the same basic functions as health insurance, only for substantially less cost. Perhaps the most significant difference between medical cost sharing and health insurance is that only one has shareholders who expect to make a profit when paying people's medical bills. The other is a nonprofit community of like-minded people who just want to make sure their medical bills will be paid. By eliminating the overhead and profit incentives of traditional health insurance, medical cost sharing ends up costing about 30 to 60% less than a typical health insurance plan. While it appears to work exactly like health insurance, some important differences make medical cost sharing a better alternative for most generally healthy people. The surprisingly low monthly cost and out-of-pocket exposure are probably the most obvious differences between medical cost sharing and traditional health insurance. But even more importantly, medical cost sharing doesn't tell you which doctor to see. It doesn't force members to stay in an insurance network of any kind. This means that members can get the healthcare they need from any provider they like. If a member is traveling domestically or even out of the country, that's not a problem. You're not going to get stuck paying extra high out-of-network rates like you do with health insurance, because with most medical cost-sharing plans, you're never out of network, no matter where a significant medical event may happen. Just like membership-based primary care, medical cost-sharing incentivizes healthy lifestyle choices for its members. It's not hard to see how when a community of people strives together to live healthy lifestyles and pay each other's medical bills, everyone reaps the benefits. Lastly, with medical cost sharing, you're not just another patient with an insurance card. When you have a medical event going on in your life, you've got a community behind you to support you, help you navigate the complex healthcare system, and help pay the bills. When we combine membership-based primary care and medical cost sharing, we get an amazing health benefit that works better for real people with everyday health needs and even the occasional catastrophic event. This is exactly how anyone can afford outstanding health benefits that don't suck. By joining millions of healthy Americans in getting the care they need and sharing each other's medical burdens in a time of true need. If you want more information, click the link in the description to go to the Scoop Health website and learn more about what they offer. To make sure you get to enjoy more videos like this, please subscribe to the channel and click on the notification bell, as we'll be bringing you more healthcare benefits news and stories. And don't forget to hit the like button and share this video with family and friends.